Welcome to Scrubbed In and Speaking Out, the podcast from the Registered Nurses Union, Newfoundland and Labrador. Here, we dive into the issues facing nurses and the advocacy shaping the future of public healthcare in our province. I'm Yvette Coffey, President of the Registered Nurses Union, Newfoundland and Labrador. And today I'm joined by Jessica Peddle. Jessica is a nurse practitioner who just so happens to be the president of the Newfoundland and Labrador Nurse Practitioner Association. Welcome, Jessica.
Thank you for having me.
So first things first, happy Nurse Practitioners Week.
Thank you.
Let's start with your practice. Where do you currently work and what drew you to become a nurse practitioner here in the province of Newfoundland and Labrador?
Currently, I work at one of the family care teams within NLHS here in St. John's. I would say what drew me to become a nurse practitioner. I knew early on when I was doing the BN RN program that I wanted to be able to do a little bit more for my patients. Mm-hmm. I knew early on that I was doing the BN RN program to step into hopefully the nurse practitioner role. So I completed just enough hours and applied for the nurse practitioner program and did the program as soon as I could because that was my goal. I set it and I knew I wanted to do it.
That's awesome. I did not realize that. So nurse practitioners have such a wide scope of practice. Especially here in Newfoundland and Labrador, we have one of, if not the biggest scope of practice when it comes to nurse practitioners. And how has that evolved since you started in this role, not only as a nurse practitioner, but as the president or involvement with the NLNPA?
When I started as a nurse practitioner almost a decade ago, there were quite a few restrictions on our scope of practice. Mm. I'm happy to say those have all been removed, and we've seen huge strides with the nurse practitioner scope since over the last 10 years. I've been a part of the NLNPA for about 2 and a bit years now, and I've even seen huge improvements in just that last 2 years. I know we've come a long way, and we still have maybe a way to go, no doubt. Mm-hmm. And I do believe we'll get there.
And how did you come to get involved with the NLNPA?
I had just got back into work after having my second baby, just came back from maternity leave and, getting back into work. And there was an empty spot on the NLNPA Association as secretary. And my friend Margot Antle, who was the president at the time, said, "Can you please help us fill this spot? We don't have anyone who wants to do it." I said, "Sure, fine, I will do it." And that kind of got me into basically where I am now today.
So Margot got you hooked.
Margot got me hooked.
What are some of the key priorities? And before I even go to that, I am going to say, just for the record, Margot she was the president for how many years?
I feel like 4 years at least, but don't quote me on that. I'm not sure.
Okay, because I know when I came into this role back in January of 2021, that first week that I started in this position, I called Margot to have a conversation about how we could, work together. Mm-hmm. For nurse practitioners in the province. And of course, anyone who knows me or knows Margot will know that was not a very short conversation. But I do know that she was one of the big advocates pushing for changes for nurse practitioners for the better of the people of Newfoundland and Labrador. So right now, what are your key priorities? Yours and your executives for nurse practitioners for the NLNPA here in this province?
First, I do want to say where we are today is hugely in part due to the previous presidents and the previous associations. They've paved the way to get us to where we are right now. I'm very grateful for that work. Mm-hmm. Currently, some of our big ticket items that we're working on is with the nurse practitioner funding model. Mm-hmm. So that is a big one. We're also, some of our objectives are working with NLHS to change the reporting structure for nurse practitioners.
You mean the management reporting? Okay, yep.
Yeah. And getting nurse practitioners in more leadership roles. For example, in professional practice, in management positions, in reporting structure positions. You know, if you have to report to someone as a nurse practitioner, then you should be able to speak to a nurse practitioner, because how does anyone know fully what a nurse practitioner does unless you're in the role yourself?
I understand that was one of the things we heard loud and clear from nurse practitioners when we've surveyed them and spoke to them. But one of the things that I have heard, an impediment, I guess, to nurse practitioners taking leadership roles like that in management is that they no longer can be licensed as a nurse practitioner unless they're actually working as a nurse practitioner for so many hours per year. I believe we need to get to a point where nurse practitioners can do that, so that employers understand that, unions understand that, and of course our college understands that too. So I'd be very interested in seeing how far we get with that. But the union does share in that advocacy part about reporting to a nurse practitioner or a nurse practitioner in professional practice who can actually speak to your scope, to what you do.
And maybe that looks like changing our reporting structure completely. It is something that we have spoke to government about, and we're hoping to collaborate with. One of the other big ticket items was, clarity and respect for nurse practitioners, which we're very grateful for the NP Clarity Project from the union. I think, that has created a lot of positive, buzz around getting the message out there of what a nurse practitioner can do.
Well, that's awesome to hear. I was in a drugstore the weekend, and all of a sudden I was like, I know that. Anyway, it was there's an MP for that. Came over the loudspeaker. I thought it was awesome. The funding model, which you talked about, all parties during the recent provincial election all committed to a funding model for nurse practitioners. I know there was an announcement I was present for where there was an announcement with the previous Liberal government that we have a pilot for a funding model. I don't know if you can give any details into that, but how far are we along in that process? And is that the path you're going to continue on?
Well, with the recent change in government, of course, there was a caretaker period, which we weren't really sure what was happening. And I can say that we actually just today had a meeting with government about the funding model, and they are full steam ahead.
Okay.
Of course, with anything new, there will be some bugs that need to be worked out, but they're fully committed to collaborating with us and getting this on the ground and rolled out.
I do have to congratulate you for getting this across the finish line. It has been talked about for years and years and years by your predecessors. So I'm glad to hear that this current government is going to go full steam ahead with that as well. So the work that nurse practitioners do often overlaps with the broader health system challenges, of course, from access to care to workload and recruitment, and more importantly, something near and dear to her part is talking about retention. How can our two organizations collaborate to strengthen that advocacy around retention, recruitment, and ensuring that we have a robust public healthcare system that serves people of Newfoundland and Labrador?
I feel like this is a recurring theme, and I think my answer to that is pretty simple. I think just getting us involved in the decision-making process, hearing us out, making us feel heard, respected, and getting us a part of that process, and how that rolls out, how that is like continuously reassessing, keeping us involved. Because sometimes what you see is processes are rolled out and we're not even involved in decision-making, and you're like, wait now. This is not even going to work. Did you ask the frontline staff who were on the grounds doing these things? So I think keeping the communication lines open, being a part of all the process, decision making, and I think that is where you'll see the most success.
Absolutely agree with you on that one. What message do you want to send to the public about the importance of a nurse practitioner?
Well, that's a big question. I think the NLNPA would love for nurse practitioners to just be seen, heard, to be an option for their care. That we are primary healthcare providers. We're doing it. We're on the ground doing it. We want to all do this, no matter where you're working in healthcare. We want to do this for the people and the patients of Newfoundland and Labrador. And, there is a lot of work to go around. And with the healthcare changing, the times changing, we need to keep up and we need to be an option for patients as well. I also feel there is a role for a nurse practitioner in every corner of the province, every different discipline, whether it be acute care, long-term care, mental health and addictions, primary health care, you name it. I feel there is a role for a nurse practitioner.
And we're seeing them everywhere throughout the entire healthcare system. I just remember 2 years ago, we were talking about maybe 200 nurse practitioners in all of the province. And now our number is...
I think we're just shy under 400 is what the new update was, but don't quote me on that either.
Okay. So, and we have double the seats at School of Nursing. So that has made an impact. We're now graduating 40 nurse practitioners each year. So I suspect that number is going to grow and it needs to grow. And I will say that I did have, lots of conversations with politicians, with the public. And any member of the public that I have spoken to or politician who has a nurse practitioner as their primary healthcare provider or has cared for them in a community setting, in long-term care. I've had my own experience with family, with long-term care, with acute care. They love and appreciate that holistic care that they get from nurse practitioners, no matter where they encounter them. So I think we're getting the message out. I think we have a lot more work to do. And to your point about collaborating and including nurse practitioners, because it's, my predecessor here would often say, if you're not at the table, you're on the table. So instead of talking about nurse practitioners, we need to be talking to nurse practitioners at all levels, with the union, with government, with NLHS. So I hope we continue to collaborate to ensure that nurse practitioners in this province are respected, not only for their autonomy and their expertise, but the care that they give to the people of Newfoundland and Labrador. Before we wrap up, what advice would you give to a registered nurse who's out there thinking about becoming a nurse practitioner or getting involved with the Nurse Practitioner Association?
If there is a registered nurse out there who's thinking of doing the nurse practitioner program, I would say you have to really want to do it. It is not easy work, and sometimes it's thankless work, but you have to really want it. And if you do want it, that this career is rewarding. It is, you get to do more for your patients, and you get to see those positive outcomes. And that's one of the big reasons why I went in to be a nurse practitioner. And for someone who wants to become a part of the association, I say do it for yourself, but also do it for your future kids, your family, your grandparents, whatever that may be. Do it for the people of this province.
So Jessica, thank you for joining me today.
Thank you for having me.
And for sharing your insights and leadership. To our listeners, thanks once again for turning into Scrubbed In and Speaking Out. Don't forget to follow or subscribe for more conversations about nursing and healthcare in Newfoundland and Labrador.